This tissue is called transitional epithelium. This one is found in the urinary passages throughout the body. It's found in the renal pelvis of the kidney. It's found in the ureters. It's found in the urinary bladder. It's found in the urethra. These are all places where the volume or the diameter of the organ or the tube needs to change rapidly over time due to a sudden increase of urine volume or pressure. The lining in this case needs to be able to stretch, and it needs to remain watertight while it's stretched, but it has to remain smooth and it cannot tear. So that's a unique set of requirements that's going to change the shape and the structure of the cells and their arrangement. So that's what we're going to look at. When you're looking at transitional epithelium, there's a chance that you might mistake it for one of the stratified squamous epithelia, keratinized or non-keratinized, because in both cases you're going to see an epithelium that has more than 2 or 3 layers. The other stratified epithelia, the stratified cuboidal and stratified columnar, they're only going to have 1 or 2 layers. So as soon as you notice more than 2 or 3 layers, you've narrowed it down to just a couple of tissues. How are you going to tell that this one is transitional epithelium? Well, what you're going to look at is the cells at the base and at the surface, like you always do. Just like with stratified squamous epithelium, the basal cells are going to be cuboidal, but the difference is at the apex. The difference is going to be at the surface for transitional epithelium. These cells are going to be flattened, but they're not going to be as flat as they would be in a stratified squamous epithelium. In other words, the cells aren't truly squamous. They're going to be short, they're going to be wide, but they're not going to be absolutely flattened. They're going to look a little bit like a sideways jelly donut. The surface of each cell is going to be domed. That's what you should be paying attention to. Now, these domed cells at the surface or at the apex are what give this tissue its ability to stretch and flatten without tearing and without losing contact with the neighboring cells. When the cells are relaxed, they get a little bit taller. When they're stretched, they get a little bit thinner. They can do this while maintaining a smooth lining and a watertight lining.